participants, greetings of the day. Today we will discuss counseling for personal growth and adjustment, and in this unit we will take up the area theory of counseling. We will discuss the behavioral theory of B.F. Skinner. The fundamental aspects of behavioral counseling theory have been identified in various incidents, physiological, traditional, particularly Stoicism. For example, Wolff and Lazarus wrote, while the modern behavior counselor deliberately applies principles of learning to this theory operations. Empirical behavior theory is probably as old as civilization. If we considered civilization as having begun when men first did things to further the well-being of other men, from the time that this became a feature of human life, there must have been occasions when a man complained to his ills to other, who advised or persuaded him of a course of action. In a broad sense, this could be called behavior therapy, whenever the behavior itself was conceived as a therapeutic agent or a counseling agent. Ancient writings contain innumerable behavioral prescriptions that accord with this broad conception of behavior theory. Possible, the first occurrence of the term behavioristic theory was given by B.F. Skinner. Other earlier pioneers in behavior theory includes Joseph Walsh and Hans Eysenck. In general, behavior therapy seems as having three distinct points of origin: South Africa, the United States and the United Kingdom. Skinner's group in the United States took more of an operant conditioning focus. The operant focus created a functional approach to assessment and interventions focused on contingencies management, such as the token economy and behavioral activism. Skinner's student Ogden Lindsay is credited with forming a movement called precision teaching, which developed a particular type of graphing program called the standard acceleration chart to monitor the progress of clients. Skinner became interested in the individuals of programs for improving learning in those with or without disabilities and worked with Fred S. Keller to develop programmed instruction. Programmed instruction had some clinical successes in Ephesus rehabilitation. Gerald Parsons used program instruction to develop his parenting text for children with conduct problems. With age response conditioning appears too slow, but operant conditioning remains relatively stable, while many behavior counselors remain committed to the basic operant and respondent paradigm. In the second half of the 20th century, many counselors coupled behavior therapy with the cognitive theory of Aaron Beerberg and Albert Ellis to form cognitive behavior theory. In some areas, the cognitive component had an additive effect. For example, evidence suggests that cognitive interventions improve the result of social phobia treatment, but in other areas, it did not enhance the treatment, which leads to the pursuit of third generation behavior theories. Third generation behavior theory uses basic principles of operant and respondent psychology, but couples them with functional analysis and a clinical formulation or cases conceptualization of verbal behavior more in line with view of the behavior analyst. Some researchers support these theories as being more effective in some cases than cognitive theory, but overall the question is still need to answer. Here are some basic approaches of behaviorism. The behavioral approach is based on the concept of explaining behavior through observation and the belief that our environment is what causes to us to behave different or suffer illness. The main categories of behaviorism are classical behaviorism. Classical behaviorism is a branch of science of psychology. It was far and away the most popular psychological perspective during the early part of 20th century, first gaining popularity in the year 1918 with the publication of an article by John B. Watson that outlined the behavioristic philosophy and enduring until cognitive psychology gained popular support in the late 1950s. As a psychological perspective, it holds that observable behaviors are the only phenomena a psychologist should be concerned with because observation is required for both objective interpretation and measurement. In other words, one can only draw a psychological inference from the behavior of a client outwardly demonstrates without relying upon the analysis of the internal process such as thoughts and emotions. This was important in the field of psychology because it helped stimulate the study among the hard science, dealing purely with the observable data in an experimental context. It is extremely important to note, however, that behaviorists do not reject the existence of internal processes. Many criticize the perspective on this point and are mistaken in doing so. Rather, it is simply the behavioristic consider these internal events a form of behavior in and of themselves rather than causes of behavior. One of the best known aspects of behavioral learning theory is classical conditioning. Discovered by Russian psychologist Ivan Pavlov, classical conditioning is a learning process that occurs through association between an environmental stimulus and a naturally occurring stimulus. It is important to note that classical conditioning involves placing a neutral signal before a naturally occurred reflection. In Pavlov's classical experiment with dogs, the neutral signal was the sound of a tone and a naturally occurring reflex was salivating in response to food. By associating the neutral stimulus with the environmental stimulus, the presentation of the food, the sound of the tone alone could produce the salivation response. In order to understand about how classical conditioning works, it is important to be familiar with the basic principles of the process. The unconditioned stimulus. The unconditioned stimulus is one that unconditionally, naturally and automatically triggers a responses. For example, when you smell one of others' favorite food, you may immediately feel very hungry. In this example, the smell of the food is the unconditioned stimulus. The unconditioned response is the unlearned response that occurs naturally in response to the unconditioned stimulus. In our example, the feeling of hunger in response to the smell of food is the unconditioned response. It is used in special education counseling. The conditioned stimulus is the previously neutral stimulus that after becoming associated with the unconditioned stimulus eventually comes to trigger a conditioned responses. In our earlier example, suppose that when you smelled out your favorite food, you also heard the sound of a whistle. While the whistling is unrelated to the smell of the food, if the sound of the whistle was paired multiple times with the smell, the sound would eventually trigger the conditioned responses. In this case, the sound of the whistle is the conditioned stimuli. The conditioned response is the learned response to the previously natural stimulus. In this example, the conditioned response would be feeling hungry. when you heard the sound of a whistle. The special child starts working when we offer a favorite food to them. Here are some methods and procedure of behavior counseling: systematic decentralization. Systematic desensitization is a type of behavioral therapy used in the field of psychology to help effectively overcome phobias and other anxiety disorders. To begin the process of systematic desensitization, one must first be taught relaxation skills in order to extinguish fear and anxiety responses to specific phobias. Once the individual has been taught these skills, he or she must use them to react towards and overcome situation in an established hierarchy of fears. The goal of this process is that an individual will learn to cope and overcome the fear in each step of hierarchy, which will lead to overcoming the last step of the fear in the hierarchy. We have some coping strategies. Prior to exposure, the counselor teaches the client cognitive strategies to cope with anxiety. This is necessary because it provides the client with a means of controlling their fear rather than relating it built until it becomes unbearable. Relaxation training such as meditation is one of the coping strategy. Administration of an anti-anxiety medicine prior to exposure to the phobia in introducing stimuli is another type of coping strategy. Clients who have serious anxiety that leads to breathing problem might be taught to focus on their breathings or to think about happy situation. Another means of relaxation is cognitive reappraisal of imagined outcomes. The counselor might encourage subject to examine what they imagine happening exposed to the phobic object, allowing them to recognize their catastrophic versions and contrast them with the actual outcomes. For example, a client with a snake phobia might realize that they imagine any snake they encounter would coils itself and their neck and strangle them when this would not actually occur. These clients needs to see that not all snakes are large and that most snakes are completely harmless so that they can get over their fear. Many other techniques can be used. Research has demonstrated the effectiveness of these techniques in helping subjects reduce their similar animal phobia. We have a progressive exposure. The second component of systematic desensitization is gradual exposure to the feared object or situation. Continuing with the snake example, the counselor would begin by asking their client to develop a fear hierarchy, listing the relative unpleasantness of various types of exposure. For example, seeing a picture of a snake in a newspaper might be rated 5 of 100, while having several lion snakes crawling on one's neck would be the most fearful experience possible. Once the client had practiced their relaxation technique, the counselor would then present them with the photograph and help them calm down. They would then present increasingly unpleasant situations. A poster of a snake, a small snake in a box in other room, a snake in a clear box in view touching the snakes, etc. At each step in the progression, the client is desensitized to the phobia through the use of the coping techniques. They realize that nothing bad happened to them and the fear gradually extinguishes. We have a behavior modification. Behavior modification is the use of empirical demonstrated behavior change techniques to increase or decrease the frequency of behavior, such as altering an individual's behavior and reactions to the stimuli through a positive and negative reinforcement of adaptive behavior and or the reduction of behavior through its extinction, punishment and or satisfaction. We have operant conditioning where it is used in special cases of drug addiction. Operant conditioning is a form of psychological learning during which an individual modifies the occurrence and forms of its own behavior due to the association of behavior with a stimulus. Operant conditioning is distinguished from classical conditioning, also called respondent conditioning, in that operant conditioning deals with the modification of voluntary behavior or operant behavior. Operant behavior operates on the environment and is maintained by its sequences, while classical conditioning deals with the conditioning of reflexive behavior, which are elicited by antecedent conditions. Behaviors conditioned via classical conditioning procedure are not maintained by consequences. Reinforcement and punishment, the core tool of operant conditioning, are either positive, delivered followed a responses, or a negative, withdrawn following a responses. This creates a total of 4 basic consequences, with the addition of a 5th procedure known as extinction, that is no change in consequences following a responses. It is important to note that actors are not spoken of as being reinforced, punished or extinguished. It is the action that are reinforced, punished or extinguished. Additionally, reinforcement, punishment and extinction are not terms whose uses is restricted to the laboratory. Naturally occurring consequences can also be said to reinforce, punish or extinguish behavior and are not always delivered by the people. Reinforcement is a consequence that causes a behavior to occur with a greater frequency. Punishment is a consequence that causes a behavior to occur with a less frequency. Extinction is the lack of any consequences following a behavior. When a behavior is inconsequential, that is, producing neither favorable nor unfavorable consequences, it will occur with a less frequency. When a previously reinforced behavior is no longer reinforced with either positive or a negative reinforcement, it leads to a decline in that behavior. For context of operant conditioning, here the terms positive and negative are not used in their popular senses, but rather positive refers to addition and negative refers to subtraction. What is added or subtracted may be either reinforcement or punishment. Hence, positive punishment is something a confusing term as it denotes the addition or a stimulus or increase in the intensity of a stimulus that is aversive. There are 4 procedures that arises. The positive reinforcement, which occurs when a behavior is followed by a stimulus that is appetitive or rewarding, increasing the frequency of that behavior. In the Skinner's box experiment, a stimulus such as food or a sugar solution can be delivered when the rat engages in a target behavior such as pressing a lever. Here the negative reinforcement occurs when a behavior is followed by the removal of an aversive stimulus, thereby increasing that behavioral frequency. In the Skinner's box experiment, negative reinforcement can be a loud noise, continuously sounding inside the rat's cage until it engages in the target behavior, such as pressing a lever, upon which the loud noise is removed. Here positive punishment, also called punishment by contingent stimulation occurs when a behavior is followed by a stimulus, such as introducing a shock or a loud noise resulting in a decrease in that behavior. Negative punishment or penalty is also called punishment by contingent withdrawal. Occurs when a behavior is followed by the removal of stimulus, such as taking away a child's toy following an undesired behavior resulting in a decrease in the behavior. We have views of human nature also. Behavioristic, with the exceptions of cognitive behaviorists, concentrate on the observed. Second is behaviorism, has here and now focus. And the third is a basic tenet of behaviorism is that all behavior is learned, whether the behavior is maladaptive or adaptive. And the fourth is behavioristic believe that adaptive behavior can be learned to replace maladaptive behavior. Behaviorists believe in setting up well-defined, measurable and observable goals in counseling. Behaviorist rejects the idea that human personality is composed of traits. Behaviorists strive for empirical evidence to support their use of specific techniques and to support the use of behavioral counseling techniques. Respondent learning is often referred to a stimulus. Responses learning in which the learner does not need to be an active participant. The outcome is the conditioning of involuntary responses. The unlearning of these conditioned responses is called countered conditioning. Operant conditioning requires that the participant be actively involved. This type of learning involves rewarding the desired behavior or punishment the undesired behavior until the person learns to discriminate the desired behavior that elicits the reward. Operant conditioning differ from respondent conditioning in that operant conditioning is the conditioning of voluntary responses through reward or reinforcement. Social modeling is the process where new behavior is learned from watching others, people and events without experiencing the consequences from the behavior of engaging in the behavior. Here we will discuss the role of a counselor. Role of a behavioral counselor are various and includes being a consultant, a reinforcer and a facilitator. The counselor is active and may supervise other people in the client's involvement to achieve the goals of counseling. Counselor using social learning may model the desired behavior, while respondent and operant conditioning counselors are more directive and perspective in their approach to the counseling goals. Use of tests and diagnosis varied greatly among behavioral counselors. Here are some goals of counseling. The goal of behavioristic counselors, like other theories, is to improve the life of a client through better adjustment to the life and to achieve personal goals, professionally and personally. Here are 4 steps in developing counseling goals. Define the problem concretely, specifying when, where, how, with whom the problem exists. And the second is take a developmental history of the problem, eliciting conditions surrounding the beginning of the problem and what solutions the client has tried in the past. Third is establish a specific sub-goals in small incremental steps towards the final goal. And then determine the best behavioral methods to be used helped in the client change. We have some few techniques of counseling. Reinforces increases the desired behavior when they follow the behavior. Reinforcers can be negative or positive. Positive reinforcers are those that are desired by the client, while negative reinforcers are contingencies to be avoided. Primarily, reinforcers are those that are instinctively called while secondary reinforcers are tokens that acquires their value by being associated with a primary reinforcer. Schedules of reinforcement is fixed ratio means that reinforcer is delivered after a set number of responses, and fixed interval means that the reinforcer is delivered after a set time lapses. Variable rationals means that the reinforcer is delivered after varying number of responses. A variable interval means that the reinforcer is delivered after varying time intervals. Shaping is learning behavior in small steps that are successive approximations towards the final desired behavior. Chaining is the order of the desired sequence of skills leading to the desired behavior. We have generalization in the transfer of learnings from behavioral counseling room to the outside the world. Maintenance of the consistent continuation of learned behavior without support from external sources to the client self-control and self-management. Extinction is the elimination of a behavior through withholding a reinforcers. Punishment is the delivery of aversive stimuli resulting in suppressing, eliminating a behavior. Behavioral rehearsal is the repeating and improving a behavior until the client accomplishes the behavior that is desired. We have environmental planning as a process where the client arranges the circumstances to promote or inhibit particular behavior. Systematic desensitization, a process accomplished through successive approximation to reduce anxiety towards an anxiety provoking event or situation. The steps needs to accomplish the behavior are listed and prioritized from no anxiety to most anxiety. The hierarchy is reviewed with the counselor, helping the client to learn relaxation technique to reduce or to overcome anxiety. As a client cannot feel anxious and relaxed at the same time, the phenomena is termed as reciprocal inhibition. Through this process, the client can ultimately perform the desired behavior. Assertiveness training is a technique where the client is taught to express their appropriate feelings without hostility, anxiety, or passivity. The actual training may include all of the other behavioral techniques to achieve the desired behaviors. Contingency contracts are written agreement in which the desired behavior are specifically described, what reinforces are to be given and under what circumstances the reinforces will be administered to the client. Contingency contracts are most often used in working with children. Implosion is having the client desensitization by imagining an anxiety provoking situation that may have a dire consequences. Flooding is similar expect and anticipated outcome of the anxiety provoking situation is not dire. This technique is contradicted for use by beginning counselors. Timeout is an assertive technique where the client is prevented usually through some form of isolation from receiving a positive response. Overcorrection is an aversive technique where the client is required to restore the environment and to improve it substantially. Covert sensitization is an aversive technique where a behavior is eliminated by pairing its association with an unpleasant thought. Cognitive restructuring is helping the clients change how they think about an event or situation by examining their thoughts and challenges the irrational or self-defeating thoughts. Stress inoculation is a 3 steps preventive techniques. Define the nature of stress and coping for the client. teach specific stress reduction and coping skills to expand those stress and coping skills with client already used. The client practices the new skills outside of the counseling room in the real life situation. Though stopping is a series of procedure which helps the client to replace self-defeating thoughts with assertive, positive and neutral thoughts. The initial process is one in which the counselor asks the client to think obsessively in a self-defeating manner. Then suddenly and unexpectedly yells, "Stop." The client cannot continue the self-defeating thoughts after this disruption. At the end, we can say that operant conditioning theory is the theory of personality organization and dynamics of personality development that guided conditioning, a clinical method for treating a client. Thank you and do take very good care of yourself.